Stewie, Daddy can't feel his legs. Go get help. I'm hanging from a door, you idiot.
Bathroom rescue missions, total hearing loss, and what in a dating disease happened here? Get ready to laugh because today we are breaking down and reacting to quick, unhinged medical scenes and hilarious injuries from Family Guy. Thank you to ScentBird for sponsoring today's video. Let's dive right in.
All right, Stewie, time to go.
What the? Oh.
A little wobbly. Guess my legs fell asleep.
This is not an unusual event to happen where somebody's sitting on the toilet for a long period of time and their legs go numb. You're compressing some nerves and blood vessel down enough to where you have difficulty walking.
Stewie, Daddy can't feel his legs. Go get help. I'm hanging from a door, you idiot.
I always advise people like just stand up, stand there and don't try to move, or like stand and kind of move the legs in one position. You try to walk, you might run the risk of falling. Just take your time, balance yourself, that sort of thing. Oh no! No! People come to the emergency department because they've lost consciousness or they smacked the back of their head. More commonly, you can have just like a hematoma or a bruise to the back of the head there. Some ice, a little bit of pain medication, everything's gonna be okay. You could also have a laceration to that area. Sometimes it goes all the way through the tissue and we need to suture it back together.
By the way, you're down to 5% battery.
Worst case scenario, you have a fracture of the skull itself or you have intracranial bleeding. Most of the time though, because it's a posterior direct hit, you don't have bleeding. It's more injuries to like the side of the head. With somebody like this in this scenario, we'd probably end up getting a CT scan of the head.
God damn it, my head.
There he is. Welcome back, buddy.
Who are you?
I'm a paramedic.
If the EMS gets to the scene, you're gonna check vital signs. If they're unconscious, you're not just gonna wait around. You're gonna get them out of that scenario, get them to the back of the ambulance, and if they're still in bad shape, you're gonna get them to the hospital.
Sir, you sustained a head injury. How many chicken fingers am I holding up, and do you want one?
3, and hell yeah.
You're not gonna give them food, you're not gonna give them drinks. People actually get pretty annoyed at us because most of the doctors will keep them NPO, nothing by mouth. We don't want to have you put something in your stomach when there's a chance that you're nauseous and you're gonna vomit, which increases the risk of aspiration into your airway. And then the other component of it is it could block your airway.
These are amazing. Did I die and go to heaven?
Well, you didn't die because I saved you. And you're not in heaven because you're not holding a margarita. Oh, wait a minute. Yes, you are.
You brought a lot of food in the bathroom.
Okay, not gonna lie, I came straight here from a 12-hour ER shift to film for you guys. No time to shower. Luckily, I've got a shortcut to smelling like I did. This is ScentBird. It's a monthly fragrance subscription service that delivers real designer cologne straight to your door. I know what you might be thinking. That must be expensive. No, it's actually cheaper than that toxin-filled body spray you're probably using. You got 120 sprays per vial, so it lasts. I did the math for you. The first month is only $8. You're welcome. You can pick from over 900 fragrances every month. It shows up at your door in a cool travel case, ready to go. Because let's be real, nobody has time to go to the store to shop for cologne.
Ain't nobody got time for that.
It fits in your gym bag, your locker, your backpack, and unlike cheap body sprays that leak or explode, this one stays sealed. Just twist, spray, and you're set. Pro tip, spray it once or twice at your pulse points, like your neck or your wrist. You don't need to marinate in it. Think smart, not strong. This month, I've been using Versace Eros and Guilty by Gucci. Both are fire, not gonna lie. Use code Dr. ER or scan the QR code to get 55% off your first month. That's just $8 your first month, and your next month will only be $16.95. Stop wasting your money and start smelling with quality scents, simple as that. And when you support the sponsor, you support the channel. That means more Family Guy reactions coming your way.
I want you to feel that your heritage is respected here. So I've made a few tweaks to our favorite classic television show.
We now return to ER.
Edited for Eastern medicine.
I need 10 cc's of
Ginseng root.
And somebody set this patient up with
Goldfish to nibble his toes.
What? Somebody is being bagged, is what we call having assisted ventilations with a BVM.
We're gonna lose him if we can't get our hands on some
Baby elephant bones.
CPR is started. You're going to use normal ACLS protocols, which include respirations, chest compressions, and medications. Very few medications are available, approved when the heart stops. Epinephrine is pretty much the biggest one that you would use.
A lot of hungry deer walking around at this hour of the night. And, oh, here's where the story gets fun. You may have noticed I'm missing an ear.
Oh no! People come to the emergency department often enough to where they do have ear injuries. Now, I've been doing this for 15 years. probably seen traumatic ear injuries maybe 5 times. It happens, it's not like massively common.
Managed to pull it out of the deer's mouth and put it in some ice I got at a 7-Eleven. So when you're ready to apologize, just talk into this cup.
You have to stop the bleeding, control that area, make sure there's no trauma to the ear canal and the eardrum.
Oh, I don't know, Glenn. Are you sure you can handle me?
Better question. Can you handle me?
Whoa.
All right, let's load him in.
The white parts of the eye, the sclera is all red and the blood vessels are intense. Could be, you know, infection versus like stress. We got a lot of sweat going on, super pale. When somebody is like really pale, we think, okay, they're really sick. Did they have bad blood flow? You know, not good, but he's got a big smile on his face.
What happened?
OIA, orgasm-induced aneurysm.
What the heck? Aneurysms, where the blood vessel is weak and has expanded, increased risk of actually rupturing. People will have brain bleeds when that happens. Sometimes you can find that somebody has an aneurysm and you can treat it before you actually have a rupture. You have an interventional radiologist put some metal coils into that area.
Poor guy slept with someone out of his league.
I gotta say, his elbows look perfect.
Thanks, Sky Rizzy.
Do some people have events after orgasms? Yes. Sometimes you can have strokes after an orgasm. You can have electrolyte abnormalities. You can have cardiac arrests that occur. Cardiac arrest! When somebody's working hard, the heart is working really hard during encounters with another individual. Oh! Baseball bat injury to somebody's head. It does happen, or just trauma to the back of somebody's head that gets knocked out. Definitely going to be a CT scan of the head and the neck.
Stewie, help me!
Oh, that's awful.
That's awful.
Brian already has an injury to the right leg in a wheelchair, falls out window, just like 2 or 3 stories. When you fall out of the window like this, more than 3 times your height, it's good to go to a trauma center. You suspect that there's a significant amount of injury.
Brian, are you okay?
Yeah, I'm fine.
Annie, are you okay? So, Annie, are you okay? Are you okay, Annie?
What happened to her?
She was struck by a smooth criminal.
She was struck by a smooth criminal. Let me know if you know the song. Multiple people are in the same area. A lot of times the hospitals it's a semi-private room where there's 2 individuals there. Versus in the emergency department, you usually have separation by curtains.
Oh my God, Peter, what happened?
What happened? A fair question. And to answer it, we have to go back a ways.
Stop doing that thing!
Aw.
Peter looks very red, either having an allergic reaction, got exposed to too much sun. Usually when you're red like that, very painful, very uncomfortable.
Brian, I think my jaw is falling off.
Oh no, the jaw is gone. That is awful. It doesn't just randomly fall off, but I've seen a lot of patients come in with like teeth falling out or broken jaws. Not too much dislocated jaws. Your jaw is not just gonna fall off, because then it would be a lot of lacerations and bleeding in this area. That's not very common.
Stewie, what is happening to this thing?
Oh, yeah, turns out the clones aren't too stable, Brian. I've been having some trouble with mine, too. Hey, Stewie.
Oh my gosh, look at the eye just coming out. Normally, your eye is just not hanging out by one thread like this. You have 6 muscles that are attached to the eye, plus the big nerve attachment in the back with blood vessels.
Yeah, I figure they've got less than a minute before they dissolve completely.
Hey, Brian, knock, knock.
Who's there?
Oh gosh, our bodies just don't melt like that. Say somebody had a clone and it wasn't working out. Typically what'll happen is maybe a bleeding disorder or a cardiovascular event, but you're not just gonna disintegrate. If you made it to the end and still smell like regret, fix that. Grab your first month of ScentBird with 55% off your first month for just $8 with code DrER. Links below or scan the QR code. Family Guy, holy cow. I love the Family Guy. It has so many medical scenes in it. It's like non-stop. Usually we learn something from it, which is great. And if you guys enjoy Family Guy, please let me know in the comments if there are any other scenes that you want me to do, if you have any questions. And as always, definitely check out this playlist right here, Binge Watch Everything. And make sure you subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.